Assalamualaikum to Sir Kamarulzaman and Sir Azwin and also my fellow friends. I'm Asman bin Safruddin. So I'm going to present about the internship presentation. For my company, it's the Clinical Hospital Kota Kinabalu. We are going through all this one by one. So next is my student profile. So as you can see here, it is already updated. So you can see my contact, profile, skills, education background, and also my working experience, which is already include the clinical's internship. So for the company background, Gleneagles Hospital Kota Kinabalu is a state-of-the-art tertiary hospital located at the Riverson, Sembulan, Kota Kinabalu, and close to the heart of the city, just 10 minutes away from the Kota Kinabalu airport. Established in 2015, GKK is a signature international brand under the IHH Healthcare and provide world-class excellence from superior clinical outcome to the highest standard of quality and care. The 180 beds offer a diverse range of healthcare services and patient care. So, Clinicals Kota Kinabalu aims to be a leading healthcare provider and center of referral or local and international patient seeking quality medical care in East Malaysia by providing the best in class clinical outcome and patient experience. So, Clinicals is a part of the international renowned Clinicals brand, which is the synonymous with highest standard of medical care and clinical outcomes. So, for their vision, it's to be a leading international healthcare provider and hospital of choice. For mission, delivering safe, appropriate, and patient-centered care through teams of dedicated professionals. So for the core value, compassion, customer and patient focus, learning culture and professionalism, and also teamwork. So here's the clinical Kota Kinabalu organization chart. So for the board of the management, there are the CEO, the CEO assistant, the financial controller, the senior operation manager, and also the sales marketing and few more. So for the sales and marketing organization, you can see the CEO officer, Dr. Tan BY, Senior Operation Manager, Jacqueline Chen, and Sales Marketing Manager as my supervisor, Nasir, and Marketing Assistant Manager, Stacy Lin. We also have the graphic designer, marketing executive, and digital marketing executive, and also the affiliate management executive. So here is the key clinical services. We they have the cardiovascular and lung center, brain and nerve center, digestive health and surgery center, women and children center, nephrology and urology center, orthopedic and sports center, and also they have the 24 accident and emergency department. So they also have the grade A ambulance service, ICU and neonatal ICU or the INCU intensive, and also the intensivist. So the medical facility, they have the anesthesiology, internal medicine, then they have the dentist and also plastic surgery. Uh, they have the nursery, ophthalmology, radiology, audiology, health screening unit, pharmacy, medical record, and rooms. So for the training reflection, we start from 1st March until 15 August, 2 months and 2 weeks, 5 months and 2 weeks lah. So for the working days and time, Monday to Friday, 8:30 until 5:30. So for Saturday, it's only 4 hours working. And the details, I'm under the sales and marketing department. So my roles, marketing teams and health screening unit training. Health screening unit, they borrow me to assist the HSU. So the responsibilities, I'm as the HSU and marketing assistant, photographer, video editing, graphic design, setup and event and medic, and my health 360 promoter, and also calling the patient. Okay, so for the task is my job is to translate flyers from English to international language, make video content for social media, retype documents, prepare goodie bags, preparing gift for special event like Father's Day, Mother's Day, and I introduce GKK application to the patient starting from the level at the level one. I also taking the item from the procurement and stock. I assist patients to bring them to the radiology and audiology for the heart screening unit. I change poster and top up flyers in every level. So what I gain in this training in my internship, I got the allowance 300 with 1 meal per day. So and also I get to manage my time. So in the morning I will be at the HSU, and after lunch I will back to the marketing department. And also multitasking, communication skill, doctors and services, and also gain about the hospital package. Okay, let's move on to the SWOT analysis. So here, for the strength, I got three strengths here. So the first one is healthcare promotion, a wide range of action and initiative. So this would be the education and awareness, which delivering the knowledge about health condition, risk factor, and ways to prevent them, such as the campaign, workshop, and community activities. We do the free maternity tour each in every month, and so on, like the screening. Okay, so next is to prevent services, which is promoting and in providing the ability to prevent preventive healthcare services, such as the immunization, screenings for health medical checkup. For example, the screening package lah, we have the promotion in every like CNY promotion, Hari Raya promotion, and so on. Second is the digital marketing awareness. So the passion, this is for the passion education material. So this is like a quick fact to inform them about the specific medical issue or the treatment option, prescription guidelines, or an healthy life suggestion. So with this educational content, it aims to inspire the individuals to educate to make educated health and well-being decision. For example, these some of the video that I make, which is the colorectal cancer screening, the hair transplant, what is hair transplant, and what is the disease, artery disease. They also uploading their activities on the social media platform, such as the health awareness at Likas, BCCM Likas, and the at anniversary celebration, hand hygiene program at the Cyber College, and we also have the dinner, the grand dinner for client. Okay, next is the specialist expertise. So in Gleneagles KK, there are various type of expertise specialists who provide specialized knowledge and support in the specific area, such as nurses, pharmacists, medical laboratory, and there are few more. So doctors are often specialized in specific area, which allow them to develop even more specialized expertise. And the example are the cardiology, pediatric, orthopedics, neurology, and so on. So for illustration, just for to quick quick example, Dr. Krishnan Siram is the only colorectal surgery doctors in Sabah. So this is a great strength for the hospital. So next is the weakness. So I have two weakness here. One is the limited slot for HSU. Because of the limited slot of HSU, there will be a delay screening, which is the individual may have to wait longer or be unable to schedule the timely screening due to the limited variety. This delay can result in missed opportunities to early detection of health condition and potential delays in the receiving necessary medical care. So, in my experience, the health screening units only allow 20 slots maximum per day, which is it also take time to finish all the procedure. So sometimes the patient got angry because of the delay. For example, the treadmill test usually take times about 30 to 40 minutes. So some patients got angry and then they complain. So second one is the lack of manpower at the accident and emergency department. A shortage of women in the A&E department have a significant consequence on the quality and efficiency of the patient care. Usually, the impact are on the patient care. So this will the insufficient because of the insufficient staff at the A&E department can lead to longer wait times, delay assessment, and compromise patient safety. It can also increase the burden on existing staff and lead to the burnout and decrease morale. Okay, next is the opportunity. So the clinicals. So the first opportunity is the clinical hospital application. This application just launched this year. So this application called My Health 360 is designed for people to manage their health anytime, anywhere, and it is very convenient and to use. This application comes with a great feature and functionality, which will define the core feature of the healthcare application. So, for the example, is they can instant access to the medical record. It can also be the health tracker into your wear, your 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 head, and it can be what is the most important is the easily online payment. Which is you can escape from the long queue. Okay, this health application it can reach a wide audience since this application is connected with all the clinical hospital in Malaysia, clinicals Kuala Lumpur, clinicals Penang. And with this application, they can attract more people to use because for now they are offering a 25 ringgit voucher when you download and make your appointment through the apps. Okay, next opportunity is the corporate insurance and public relationship. This is what we call the community engagement. An active engagement with the local community is crucial. So the healthcare corporation can participate in the healthcare community events and health education programs to demonstrate their commitment to community well-being beyond just business interests. For example, like we encourage them to come to the hospital to make a hospital tour. Uh, uh, or we introduce to them about the package that they have. Okay, uh, clinical hospital make their public relationship, such as with the corporate company, police, bank, and also with the other doctors from other clinics, and also the insurance company, Great Eastern, AIA, Prudential, and the most important is the other country often chose the best hospital with the high quality medical service and facilities. So some of the clinical patients come from other country to get the advanced healthcare system. So for example, is there one patient from Indonesia come to clinicals just to get treatment for their for to meet Dr. Tala, who is the cardiac doctor, and help them to do the surgery in the heart. Okay. Next, the last is the trade. So the trade is the first one is the competitor from the other healthcare. The other private healthcare provider, which the private hospital, clinics, and healthcare facilities compete with each other to attract patients or to get more people to come to the hospital. So there may be the differentiate themselves based on the range of the service offered, quality of care, reputation, and amenities. So, specialized medical center which private healthcare provide may face competition from specialized medical centers that focus on on the specific field of medical medicine, such as the treatment center, fertility clinics, or the orthopedic center. So, for the example, is one of the clinical hospital competitor is the KPJ. Since that the KPJ also trying to do the clinical stuff like the maternity tour. So okay, next is the second. Second is the price is higher than the government healthcare. So this is true. So because the cost of government healthcare is cheaper than the private healthcare. This is because these two health facilities offer different costs and expenses for the treatment of the same disease. Also, because of the quality and facility, private healthcare providers often invest heavily in medical equipment, advanced technology, and luxury facility to provide a premium healthcare experience. And not only that, we also be charged. So for the private hospital, they will also charge extra for the other additional treatment lah. And also, okay, the decision whether to choose a government hospital or private hospital depends on the financial situation lah, and also health condition. So if you want to enjoy the cheaper treatment cost, you can get the treatment at the government hospital. Okay, as for the recommendation, first one is the recruitment and retention. Which is to address the shortage, healthcare organizations should focus on the recruiting and retaining qualified staff. This can be achieved through competition, compensation package, professional development opportunities, and a positive work environment. So collaboration with the medical schools and offering intensive for the medical professional to specialize in emergency medicine can also help to attract a new talent. Second one is the workflow optimization. Analyze the workflow within the health screening unit and identify the opportunity to streamline processes, which is to simplify the administrative tasks, implement the technology solution, and eliminate the unnecessary step to increase the productivity and reduce the burden on the staff lah. The third one is the temporary staff solution, which is the exploring option for temporary staff lah, such as the hiring locum doctor or nurse, or partnering with the staff agency to fill the employment gaps. So in the audiology, we have the locum nurse, and this can help to alleviate some of the workload pressure and ensure that the patient are attend to be timely manner. Okay, now we at the conclusion. So I gain a lot of knowledge about the healthcare company, not just in the marketing management, but also in the healthcare service. Like I said, I suddenly got the chance to work at the health screening unit. So it was a great pleasure to do my internship and learn in a new environment lah. Clinical Hospital KK is a great organization to do your internship. It is because how they manage the company. As for the sales and marketing department, they are very active in making or conduct so many events. Uh, just like yeah, so which is good to improve my soft skill, communication skill, and multitasking skill, and so on. Okay, that's all from me. Thank you.